mask for 5 shifts, which is not safe because technically you're supposed to use one N95 whenever you go in the room and then you come out and you throw it out. But we were so short that we had to use an N95 mask every 5 shifts. I was actually really worried. It was the beginning. I didn't know we all didn't know how this virus was transmitted. We didn't know how we were going to get it. We were trying to be super cautious. We didn't know who was at risk. So everyone thought that if they were working there, they were going to die. So I was also really scared. I didn't have a lot of N95 masks with me. I actually reached out to the Singapore embassy, and Jasmine was so nice, and she reached out to me, and she had some N95 masks with her and some gowns, and she sent them to me with the card. She was so sweet, and that really touched my heart. And also I think she reached out to others in the Singaporean community who also were so nice, and they sent me boxes of masks and gowns and hairnets that really came in handy, that I've been using, and they're so useful. And because we wear one and we throw it out at the end of every shift, so every mask that I received, I'm so thankful, and I'm so glad that Jasmine reached out, and Michelle to help with the PPE shortage that I was facing. Right now, I'm using a P100 that I got from one of the hardware stores here, which is that heavy thing on my face. It lasts for about over a month. So I just have to change the cartridges every month or every 6 weeks or so. So that I just clean it with alcohol wipes and chlorhexidine wipes at the end of my shift. So it's more efficient in terms of I don't have to keep looking for something new every day. I don't have to throw it out. And then the face shield also, I wipe it down with alcohol at the end of my shift. Right now we still have to use one N95 mask every 5 days. We have more gowns available, which is great. More masks, more paper scrubs, more suits. But the mask is still a problem. We still have to ration it out. Yeah.
Nadira, what about you?
So thankfully for our side, we have initially just enough, and then obviously with the influx, the surge at the peak, we were worried, of course, and we had donors. We were very fortunate enough, donors and people from overseas. There were some from China actually donated. They actually posted to my boss's house. So it was very nice, and he brought in for all of us to use it. Obviously we had the administrators, the nurses had to keep it, because there was a moment where some of them were actually stealing them. There was it got lost somehow, so obviously it was kept under really locked, and when we needed it, there is definitely enough. Right now, we do have enough, but of course, I think, preparing, basically trying to get in all the stockpiles now, hoping that there is no resurgence of this.
We've gotten a few questions in our Q&A, as well as in the questions that were sent in before this chat, on your decontamination routine daily as you were coming home from the hospital. Did you have a routine that you sort of tried to abide by?
Yeah, I have a routine. After my shift, I go up the stairs outside my residence lounge. I take off my gown, I throw it in the trash. I throw my shoe covers in the trash. I throw my Tyvek suit out. And then I have to carefully take off the face shield, take off my goggles and the mask, and then wipe all of that down with my wipes, the alcohol wipes. And then I put that in a bag. I thoroughly wash my hands, wash my face. And then I put a mask on. I take an Uber home because I don't want to take the bus. So when I get home, I leave my shoes outside. I leave my shoes outside. I come in, and then I just remove all my clothes in the hallway. And I have like a little basket, like a laundry basket where I put all my contaminated work clothes in. And then I just jump in the shower and wash my, I have been washing my hair every day. It's terrible, but I do it because I don't want to, I want to be safe, and like my hair is dropping. But yeah, that's my whole decontamination like process.
Nadira, do you have one?
Yes, I think sounds similar to Jessica. So at work, remove the shield, make every time, basically every other patient, literally just wash it, wipe it with the alcohol wipes. And we are fortunate enough, the scrubs being provided every day by the hospital. And so they wash it. So essentially removing them, put it in the laundry bags, and then just giving to them to wash, because the next day you'll be given another set of scrubs essentially. So you don't have to worry about washing your own scrubs. And like Jessica, taking an Uber, I don't dare take the subway, even though Governor Cuomo said he has disinfected the subway. I still take the Uber back home, and similar like Jessica, just remove my shoes and literally wash my hands. And the first thing I do, just go straight to the bathroom after putting my bags, taking off all my clothes, and just dump it in the washing machine and literally have a shower. And I do wash my hair every day too, which is may not be healthy, but scrub all every day. Yeah.
So besides, I think the physical, toll that this thing, this COVID pandemic has really taken on the both of you, there is of course a lot to be said about the emotional as well as psychological toll. We've read a lot in the news about doctors really, how should I say it, coming in as, I think, that very much needed source of solace and, as caretakers, because, now that visitors are not allowed anymore, a lot of people are at the end by themselves, without families and so on. And, you're just seeing people just go through these difficult things every day, and it's happening all around you at work. If you, the both of you could just share a little bit about how, you processed this toll and how you, coped with that. Yeah. Maybe Jessica?
Yeah, there's a lot to deal with, especially since it happened so suddenly. I remember going to work every day, just worried, wondering if I would fall sick. There was a period of time where I was just having a dry cough, and I was so worried maybe I was going to get COVID, and maybe one day I was just going to decompensate and, I don't know, end up on a ventilator. Because you're fighting an invisible enemy. Like the virus, you can't see where it is. You don't know where it's coming from. You can clean as much as you want, but you don't know if you forgot something or if you messed up. Like if something slipped your mind or if you weren't careful. Especially whenever I was close to a COVID patient or intubated a patient, I'm always going through the thoughts of did I wipe the equipment down properly? Did the person wearing the intubation stuff wipe that down before I put it on? Did they do this? Like going through all these emotions, going through the thought process. Did their viral load somehow get through my face shield? So like it definitely caused a lot of additional worry on top of the daily stress that already we're facing in a high stress environment, like in the emergency room. And also being away from family and not being able to hang out with your friends or have that like social support network, like when you're alone, it's a lot more different, even though you're on Zoom or on WhatsApp or FaceTiming. So that was challenging. But the good thing was I was still able to go to work and still have that normalcy, because I was going to work and interacting with my co-residents, with my co-workers at work. And I think a lot of my support came from them. And also, I'm so thankful that we were allowed to go outside and run. And I used to run, I still run a lot. That helps me like process things, and it's also healthy, keeps my endorphins up. After I finish my run, I always realize I feel happy from my runner's high. So, and yeah, and I was also eating a lot of Nutella and Oreos and cookies and gained 5 pounds from this quarantine. But that's okay. I'd rather be 5 pounds heavier than be depressed and maybe, I don't know, intubated on a ventilator.
Yeah, coping, I mean, no shame in terms of the coping mechanisms. We all have our own. What about you, Nadira?
Oh, I mean, besides, the stress of handling these patients, I think seeing these patients and, as we both mentioned that these patients are not allowed visitors. So seeing their psychological depression is also quite hard on us because we have to call their family every single day to update them, and it's very depressing because they're not able to see. So we have iPads. So we do FaceTime with the patients. So we have to gown up and then go back into the room with the iPads. So me and my team, we take turns. So, on certain days to do that. And once I remember one patient of mine where both the husband and both she and her husband were admitted and were intubated, with the tube down the throat. And unfortunately, the husband passed away, and she survived. And it was very heartbreaking when we had to tell her what happened to her husband. And on top of that, she had a 21-year-old son living alone at home. So it's very depressing, and seeing and learning all the stories, and it's just not one patient, but there are many of them of similar stories or even worse, and the losses that they have. So, myself and my team, the physician assistants, we dealing this every day, day in, day out. It's emotional stress for all of us, but we all hang in there together, support one another. We communicate. I think sometimes we over communicate. Like my boss said, over communication is good. So we have in 1 week, we have, I think almost every day, at least a call amongst some faculty or some department meeting to make sure that we are all mentally okay. And they provided avenues as well, people that you want to talk to. But for myself, it's, having my family support there, and then my friends, be it in Singapore, over here, and also other parts of the world. So depending on the time, so in the, New York afternoon where Singapore is sleeping, I have my other friends in London or elsewhere to call me to make sure I'm okay. And then when at night you have the Singapore, my family and my friends calling to make sure I'm okay. So I'm grateful for that. And the support that I have to help me get through this tough period.
I'm so glad to hear that. It must be so stressful for all your friends and family back home in Singapore to have you be here on the front lines, in the epicenter during this. Like I mentioned earlier, I think we're all, being a little bit optimistic that we are seeing some light at the end of a very long, tunnel here. As the number of cases, start to decrease here in New York, as you look back on the last couple of months, what are the things that have really struck you the most, about yourself or about your colleagues, on how you guys have handled this pandemic?
I think for me, this last 1 month, I think it just shows, the human side of everyone, where the unity, the support, the discipline of every New Yorker that I've met, the love and the respect that each and every one of us have be it New York or anywhere in the world. I think everybody here that the department, everyone are being selfless and stepping up to not only their job, but above their job and helping one another whenever anybody is in need. It's truly a remarkable experience for me seeing, and it has brought all of us closer to one another. So honestly, it's been an experience. There's so much that we have learned looking back retrospectively and where we are right now, especially we call it the New York COVID land. So what we've been through for the last 2 months, where we are now, I think there's so much more looking forward, especially to the reopening phase. So, there's many more things that we have to do.
Yeah, that's a really great answer. And Nadira, just being a senior doctor yourself, do you have any advice for Jessica as she completes her training, and just emerges into this strange new world as an attending physician in a couple of weeks, actually?
Oh
so
my God.
Really exciting times for Jessica, but she is coming out,
We don't have a graduation because we can't have a graduation. So.
Absolutely, Jessica. Heartiest congratulations to you graduating from residency. I remember back in my days, not too far along, but it's a huge achievement. My heartiest congratulations after all the work that you have put in. The endless nights, the sleepless nights, the calls, the hard work that you put in. It's truly deserving. And I know it's, unprecedented, at these times, in these circumstances, usually you have a party with your friends, your residents, your co-residents, and your bosses. It's a difficult one, maybe a virtual party. But I'm just going to quote like what President Obama actually said to the graduating class last week of 2020. He quoted and he mentioned, he advised the class to be fearless, and do what you want, do what you think is right, and go for all your dreams. And I wish you all the best and success in your endeavors in your new job. So huge well done.
Thank you so much, Nadira, for saying that. I appreciate it. Thank you so much.
No problem.
Yeah, it's really strange times that you're emerging into, Jessica. So I know that we, have run a little bit out of time today, but I just want to go very, very quickly into some of the community questions that we have been receiving. Many of you in the audience actually sent along some really thoughtful questions and comments, as well as in the Q&A as well. And we are, I think, just actively trying to keep track of everything. And these are the ones that have come up really the most. If I could just invite Jessica and Nadira to, if you have any thoughts on them, we'll just quickly run through, I think, some of the questions that we see on the screen. I think the first one that, you see there is something that a lot of people would like your views on. How would you describe the way this pandemic has been managed, and do you wish anything had been done differently? Anybody? I mean, maybe Jessica, since you really faced this in your last few months of residency training.
I think retrospectively, at least the hospital that I worked in, managed it pretty well. We just didn't see it coming, and then it hit us in the face, and we all just gathered whatever resources we had. All these people in leadership that like formed communities and would daily having these briefings every day to try and help the whole hospital manage COVID, and especially protecting the staff and keeping us safe from COVID, and also streamlining patients so we could treat them appropriately. I think we did well. Speaking from 2 months into the COVID pandemic, I guess the only thing, if we could have seen it coming, if we could have done it differently, maybe in terms of PPE and just us psychologically feeling safe while treating these patients, because that was the main thing. We didn't know how we were going to get it. We didn't know what our risks were. Everything was just so new. So I guess this will help. No, I mean, being here for 2 months has kind of given us the confidence to continue to treat patients, because we've already been dealing with this and we've been fine for 2 months. So I guess this is like good experience if a second wave was to come about.
Yeah. This leads us really nicely into the next question. Maybe for Nadira, you know, how are your hospitals actually preparing for a possible second wave? Here in the news as well, they have been talking about in the last couple of days on how there's a very possible second wave with the reopenings, as well as in a couple of months when regular flu season starts. You know, how are your hospitals kind of dealing with that?
That's a great question. You know, obviously we have learned a lot from the last 3 months, not only from in terms of equipment, how we manage these patients moving forward, and of course with the, you know, numerous trials that's ongoing right now in treating these patients, in managing these patients. So we are preparing. In terms of the stockpile for PPEs, I think the administration are certainly doing that to prepare that. And of course, you know, besides for this possible second wave, like right now in terms of the reopening, so the administrations are, you know, are thinking very hard and are, you know, proposing how logistically patients to come in to see their own doctors, right? You know, at the reception, so, you know, in the waiting room, so where do they sit? So in the elevators, like just a couple of days ago, the elevators, like in Singapore, you have, you know, where not everybody can go in, so only a certain number of people can go in. So I think everybody in the hospital and everywhere else, I'm sure in all businesses, are thinking of these logistic issues or reopening, because ultimately to prevent that second wave or to reduce the impact of the second wave is through the three main things, which you hear in day in, day out: wearing the mask, using, you know, hand washing, using sanitizers, and safe distancing as well for 6 feet. So these are all the necessary steps that every one of us need to take in order to reduce the impact of the second wave. And hopefully, you know, we don't see the same thing as what we did a couple of weeks ago.
Yeah, we certainly hope so. And I think we also had a few questions, especially I think from concerned parents and families in our audience. Here in the US, we've been hearing of cases of children presenting with symptoms of pediatric multisystem inflammatory syndrome. So just Kawasaki, I think, disease for the layman. Could you both just explain a little bit to us about what these, you know, symptoms are and how concerned should parents be?
So this is something new also. And in at least with our emergency department, we've been given some guidelines to look out for these children that come in. So according to the guidelines that we have, if you see a child who's had a fever, you know, more than 38 degrees Celsius for more than 3 days, and if they have additional symptoms, could be anything like nausea, vomiting, diarrhea, if they have a rash, usually like their skin is peeling, they have swollen extremities, like their hands and feet are swollen, they have cracked lips, they call it a strawberry tongue because their tongue is so red, they have conjunctivitis, so it's like pink eye, and also like swollen lymph nodes. So these like overlying symptoms with fever would be a red flag for any like emergency physician dealing with these kids that come in. And so that's like what we look out for now, or even children who have a fever for more than 4 days without any source. So we don't know if it's coming from, if it's because it's coming from their lungs, or, you know, they have a urine infection, or if they have a sore throat that's causing the fever. So this is what we look out for, and then we do further tests to see if maybe they have the COVID antibodies or if they have COVID and manage them. Yeah.
Mm-hmm. Yeah, Nadira, anything to add about, you know, how concerned parents should be about this new symptoms the things that are coming up in the media, because I think that's causing some concern among parents.
Absolutely. I mean, obviously we all thought that this disease is for the elderly, the vulnerable, where people have certain risk factors, as you heard, in the media. The fact that 3 children passed away from COVID-19 from this multi-system inflammatory syndrome obviously took all of us by surprise. The symptoms, as Jessica mentioned, I mean, we worry. Obviously, we have no clue in terms of why how the pathophysiology of this disease in children. A lot of research now, obviously, we are looking into it. The CDC is actively looking into it, but of course, I think the necessary steps is needed to take to protect your children. I think in the CDC website recommended, the use of masks for children, anybody who's more than 2 years old. Similarly, safe distancing, hand washing, sanitizers, all the same necessary precaution is needed for, your children as well.
This is a great segue into the next question, which is, in this new normal, what precautions we can all take to lead our lives safely? Are masks, how effective are masks against the virus? How effective is hand washing? I know, this has been covered extensively in the media, but I think it'd be very helpful for us to hear from you both as well. Yeah, maybe Jessica wants to start.
Yeah, I'm very, I'm all for washing hands. I always wash my hands, whenever when I'm outside, I always make sure I don't touch my face, I touch my eyes, because that's how the virus can, infect you. Alcohol, like Purell, all these like alcohol sanitizers that we use, like when you go outside, I always personally have a mask, and then I wear my fake glasses just to be cautious, and I have my hand sanitizer with me, and I'm always wiping my hands. And so just be aware and cautious, like especially when you come home from being outside, to make sure that you wash and Purell your hands before you touch your face or eat or put anything in your mouth. And I think I'm glad that we have this rule where you have to wear a mask when you go outside, because I think it's effective in preventing someone who is sick from giving you the disease, from giving COVID to you, as opposed to, I'm sure there is some protection if you wear the mask from getting COVID, but then it's not completely sealed. It's not filtering out particles that could have the COVID virus on it. So that's why they say it's not as effective in protecting yourself from the COVID virus. But the fact that everyone is wearing it reduces the rate of us contracting this virus, I feel. So I'm glad that, like he's almost implemented this rule saying that we should all wear masks when we're outside. And yeah.
Yeah, Nadira, what about yourself? I mean, we're hearing some, cases of people not wanting to wear masks because they feel it's personal liberties, and it's something that they should decide whether they want to do for themselves. How effective are masks, during a time like this?
I and everyone else definitely think that masks are effective. I mean, we do have evidence. I think Governor Cuomo said it every day in his press briefing about masks. I think today he also mentioned a study, where they did a study of emergency physicians. I'm not sure which New York hospital was it, and the rate of transmission within the emergency department is actually lower than the rate of transmission than the public, and it just shows how effective masks and hand washing is in reducing the transmission rate. And even in Colombia as well, so we divide the certain floors to the COVID and non-COVID. So a couple of my colleagues actually did a study in the non-COVID to see if the rates of nosocomial infection, so the rates of whether or not these patients in the non-COVID, what are the chances of them having COVID? Because we are exposed to it, we walk daily, everywhere, but we are wearing masks in the hospital. So they found that the rates of transmission is actually 0. So in this group of non-COVID patients, so actually using a mask is very effective against the virus, and we cannot stress enough. And I know there's, various 3 types of masks. You have your cloth type, you have your, surgical masks, and you do have the N95s. Be it essentially making sure that you have a good seal covering your nose and covering your mouth when you wear it. And I think it's, essential that everyone uses the mask to help protect yourself, not only yourself, but also other people as well. And also, I just found out that in New York, they have a mask. They made a video about masks. I'm not sure, Michelle, you probably saw it in Andrew Cuomo's talk today, that there's a competition about mask wearing, encouraging every New Yorker to wear the mask. And there's a vote for who makes the video the best. So it's online.
No, I've not actually seen that, but I am a big fan of Governor Cuomo and his briefings as well as his PowerPoint slides.
That's right. And I think his daughter is the one who came up with the idea of this. Great. Yeah, this Wear the Mask campaign in New York.
That's really wonderful. Yeah, I'm a big fan of this. Yeah, so I think this is a really good time to maybe touch on the last 2 questions really quickly. We have a question in our Q&A section that I think it's quite interesting, which is, to the both doctors, why did you decide to stay, and work in the US as doctors? And I guess related to that, is the question of how this experience has really maybe reaffirmed your commitment to choose healthcare and medicine as a career. How has this all kind of worked out for you, and how does it affect your time here, your future in the US?
So for me, I chose to be in the US because I like the opportunities that it presents here. Just the field of emergency medicine is pretty new, and also it pretty much the US was one of the first few countries that started this field of emergency medicine, training doctors to in critical care and acute care. And I find that it goes along with my personality. I'm very last minute, and I like, just the dealing with the crisis when it presents, and then you solve it, and then you move on. I'm glad I chose this field because it's really, I feel like it goes well with my personality. You work in like a chaotic environment, and and you're seeing all kinds of patients. Anyone can walk through the door, especially, and being in New York, we get a lot of trauma patients also. Gunshot wounds, stab wounds, car accidents, and like stuff like that you don't see in Singapore because of the different like restrictions and laws. And so it has given me the opportunity to train and learn how to deal with sick people like that, people who have been affected like that. And also, so this has been a great place for learning and opportunity. And that's why I chose to do my residency and still get some experience here.
That's amazing. Nadira, yeah, sorry.
No, go ahead, Nadira, it's your turn.
For me, I remember when you said that question, it just takes me to the time when my mom called me. This was, I remember, I think it's a Monday or Tuesday night, where after she saw, I think, the news in Singapore, that Singapore Airlines shut down, grounded all their airplanes. And she called me and she said, "Aren't you coming home?" So that is, that was when it hit me, when, oh dear, everything is closing off, and this is real. And but I told her, I said, no, you know, this is my job. This is what I'm here to do, you know, and other thoughts in my head, which I didn't tell her, is that, you know, I'm not sure whether I myself was exposed to COVID. I didn't want to go all the way back, although I know at that time, you know, Singapore, you know, government were quarantining everybody for 14 days, you know, in a hotel somewhere. But I didn't want to expose my family, and I knew that my not only job, but this is what I've been taught to do. This is what my passion is, you know, helping people and not leaving my colleagues and my friends here who needed me the most in whatever way they needed me to help. Even be it whether it's a small thing or a big thing, I think being here to support them, I think makes a huge difference. And I'm very glad and happy that I stayed and helped. And as to why the US, I think I was given the opportunity to work with one of the best teams in my field, which is the interventional echocardiography. And it's this technology that I love and found my passion in. I'm very fortunate to be involved not only in the clinical work, but also in the research work. So there's a lot more things that we have to do. So that's why I decided to be here in the US.
It's really heartwarming to hear. So, you know, finally, I think the last question that is on everyone's minds is, you know, both of you have really given so much of yourself to the community and those around you, especially during this period, you know. So really the question is, how can, you know, we as a community support you? You know, are there ways that we can actually help you, you know, either in your job or in other ways to make your days here a little bit easier?
I can't think of anything off the top of my head now. I'm sure there will be something that I can think of eventually, but what I've been thinking of through this whole process, getting to know you guys, was like, I would really like to be in touch with the Singaporean community here and, like, you know, get to know some names or some people and just like be able to, you know, just like build a community here, which is something that came up from this pandemic. It's like I got to meet you guys. I got to meet Michelle, Nadira, Jasmine, which was so it was just like a nice feeling to know that there's a group of people there that, you know, that I can reach out to and that's supportive. And yeah, if I could get to be like, you know more people in this community, I'm looking forward to that.
Yeah, I think a lot of people are looking forward to meeting you guys as well. But we have to do our lunch, you know, after this.
Yeah.
Yeah, that's awesome. Nadira, what about yourself? What can the community do to support you?
Oh my God, I never thought of that. I remember when I reached out to Jasmine by email was my first thought, you know, I'm after looking after these patients, like, oh, I wish that there's no Singaporeans who fall sick or, you know, or in need in any help. And I thought in any way whether I could offer my services. That was how this all got started, you know, so I'm truly humbled, you know, obviously, you know, happy to help the Singapore community here in New York in any form of way. One for sure is having local food once we reopen, that is for sure. And hopefully to meet all of you in person.
Yeah, likewise. I think we all can't wait to sit you both down and have a chat. And yeah, thank you so much.
Thank you.
Yeah, thank you. So thanks everyone. We have come you know, to the end of today's sharing. I just want to thank Jessica and Nadira for their time today. I think we can't begin to express how thankful we are for frontline heroes like yourselves. It's been such a privilege for me to be speaking with you and hearing your stories, and I'm sure for all the audiences tuning in as well. You know, everyone is thanking you for your service too. And you know, thank you to all of our audience as well for tuning in and for all your very thoughtful comments and questions. Please let us know your thoughts. We have a post-event survey that should pop up right as you leave. And also, just as a very quick heads up again, next week, the Singapore Global Network is going to be hosting a very special fireside chat with SMS Janil Puducherry. He will be sharing Singapore's COVID-19 response, some of the behind the scenes, decisions, why Singapore reacted the way she did, what were some of the considerations and how the future looks like for Singapore going forward. This is a very special conversation that we are putting together just for overseas Singaporeans, our citizens and PRs. So we definitely encourage you to join in. It's going to be a really good one. And so thanks everyone. Please stay safe, and we hope to see you online soon. Again, please stay safe, stay home, and stay well. Thanks everybody. Thanks Jessica. Thanks Nadira.
Thank you.
Thanks everybody.
Thank you.
Bye.